members of Congress are this week learning that concerns about the health care overhaul have not gone away just because the bill is now law. A number of Democrats who voted for the bill scheduled meetings to sell their constituents on the benefits in that law. Take a listen to what happened during a town hall meeting held by New Hampshire Congresswoman Carol Shea Porter. And she tries to explain how the health care overhaul will save money.
Budget office is nonpartisan, and they do a very, very good job. They did a good job in Medicare Part D. They're actually very, very conservative about this. This is going to be paid for, and it's actually going to help reduce the deficit.
What's this 10-6-year balance thing?
How about Medicare when it started? So what was the original CBO estimate? Right now. Come on.
When everybody's ready, then I will continue. Okay. So this is what's going to happen.
Without having to pay a bill, I'd be in good shape.
Ready? Okay, this is what's going to happen. The way that we're going to pay for this is part of it's going to be paid for by controlling the waste, the fraud, the repeats, taking Medicare Advantage, which has been receiving about a 14% subsidy over traditional Medicare, and taking that away, because there's really no reason for privately delivered Medicare to do that. So that's the first part. The other part of it is for those who are earning $200,000 as an individual, $250,000 as a couple, will pay more on their hospital tax. So we'll see that for the Medicare.
That's not fair.
So we'll be paying that. And I think I want to point out to you that everybody who voted for that health care bill already had
broke the Constitution.
And almost everybody who voted for that health care bill voted to put the tax on themselves as well. So I think it's important to point out that members of Congress who voted for that had health insurance themselves and voted to tax themselves. Okay. The other part of it is a 3.8% tax on higher income to pay for that. So not income, but the higher earners, and it will be on unearned income. In other words, not on their job.
Some people
Now, 200,000, 250,000, most Americans don't fall anywhere near that. That really is about the top 2%. So most people will not feel that at all. And that's how that's going to be paid for. So we can start asking questions.
Well, so are things cooling down since this law passed, or are they heating back up? Britt Hume is our senior political analyst for Fox News Channel. He's my guest now. Britt, you know, these lawmakers may have thought that, as Nancy Pelosi said, you know, we have to pass the bill to figure out what's in it and then to start selling it to people. Not so much success selling it to the folks in New Hampshire at that town hall in any event.
Well, the interesting question here, Megan, all along has been whether people know what's in this bill, and that's why they're opposed to it, or they've heard a lot of false things about it. My sense about it is that people really do know what's in this bill, and they've been told about all its supposed wonders, including the wonders of cost saving, which the people in that particular audience that you just showed there were clearly skeptical about, laughing openly at the idea. And they have good reason to feel that way, Megan. I mean, you think you're going to add 20 to 30 million people to the health insurance rolls and create the demand for health care services that people who now suddenly have insurance will exhibit. Where are you going to get the doctors? Where are you going to get the facilities? There's nothing about this measure that seems likely to create new doctors, hospitals, and health care facilities. So what most people suspect is, A, the cost is going to go up with the demand, as it will, and it'll be dealt with by shortages, rationing, and what have you. This is what people are concerned about, and it seems to me a reasonable concern.
You know, the thing that's interesting to me about it, Britt, is that when this bill was still a bill and was not yet law, we saw the White House and its supporters on health care come out and say that the public was being misinformed. They talked about Sarah Palin and her charge of death panels. They pointed to some in the media alleging that they were misleading people about the bill and saying that, you know, in the end, the White House knew what was in the bill was going to be good for Americans and Americans would come to embrace it. That may or may not be true, but the bottom line from these town halls appears to be, Britt, a lot of the people still reject it, still don't believe it's good for the American people, and whichever the truth is, whether it's as the White House believed or otherwise, at the end of the day, what matters is what these voters think. Is that going to carry the day from this point forward?
Well, the hope that Democrats have is that the benefits that are in the bill, and some people will no doubt feel that they're benefiting from this, will change voters' minds about it, and they hope by November. I think it's doubtful that it will happen by November. And remember this, Megan, there's kind of an overarching theme in all of these protests that we've seen going back to February of last year. And that was about the time that the bailouts had been put in place and people didn't like them and they were worried about the cost of it. The budget deficit was rising in a way people had not seen before. And on top of that came that $787 billion stimulus package, which had so many apparently wasteful projects in it. People really hated that. And that gave birth to all of this. And we have seen a rise in the public's anxiety about debt and deficits to a level that I've never seen before. This bill adds to that in the minds of its critics and in the minds of many people. And that is not going to change. That attitude is not going to change, it seems to me, by November. People are still going to believe that this thing will not reduce costs and will indeed add the deficit. And the poll numbers show that that's what people believe.
Yeah, and not just debt and deficits, but big government. I've got to go quickly, Britt, so just your reaction on that, the big government threat that we're seeing, especially in places like New Hampshire.
That is part of the whole worry about it's the size of the spending and the size of the government as well. Two sides really of the same coin.
Yeah. Britt Hume with a View, thanks so much for being here.
Thanks, Megan. Always good.